It really helps. My daughter is an infant. Formula is very, very expensive. And I just feel like it should be more, we shouldn't have to be deterred at all to try to receive benefits. This new change, if it does happen, I feel it will be a burden, not just to me. I'm not the only single mother out here. It's plenty of others. It's also low income people. So a change needs to be brought, and if this cut is made, it will really hurt. It will cause a huge deficit. It would affect our communities. Possible more crime can happen. So I'm here today to try to see how we can help eliminate this.
Is that individuals think those who are poor are individuals who are not working. That is absolutely 100% false and incorrect. When we talk about the poor here in the United States, we often talk about the working poor. Those individuals who are out there trying to do something for themselves, their family, and their loved ones, but sometimes just cannot make ends meet. You know, we had a pastor earlier today give us a quote and talk to us about personal accountability. I would like to give you a quote from another pastor, a young man who came from Atlanta, Georgia. And he said, when someone asked, "Who do you consider your neighbor?" He said, "All of those who in need are my neighbors." And when we think about when we do things, we shouldn't ask, if I do this for that person, what could it do to me? What we should be asking is, if I do not help this person, what could happen to them? And this pastor was one, I think, that without question had the compassion and the forethought of the ages. This young man's name was Martin Luther King. And I think he knew a little something about caring for those who are in need.
We provide our staff with great wages, vacation, holiday pay, health, dental, vision coverage subsidized at 50%, matching 401k, and many other specific benefits. Last year we bought a daycare in order to provide subsidized daycare for our staff at a 50% rate. However, our company is still suffering from COVID, and right now we still cannot get enough employees. We need about 70 more employees. In spite of the fact we pay some of the best wages around and give Fortune 500 benefits, we are still short of staff. Let's be clear, I'm a firm proponent on providing a hand up but not a hand out when it comes to welfare. I truly believe that when people are suffering, we need to find a way to get them over the hurdles that they are facing so they can get back on their feet. However, far too many use welfare as a crutch, allowing them to not work. We've heard many firsthand stories. One that comes to mind right now is a lady who wanted to work full-time but could only work 19 hours a week, and she knew right to the dot how much she could work or she would lose her benefits. To that I offered the opportunity. I showed her a financial analysis showing that she could work full-time and actually do better than the combination of 19 hours and benefits, to which she rebutted, but then I'd have to work the extra hours. Currently, we know of many potential employees who could be working or working more hours who choose not to because they will lose their benefits. To them, it seems like common sense to continue down a path that they and likely previous generations have followed before. And we cause that to some extent. I believe that some of the steps to consider should be offering and mandating better financial literacy classes in high school, more support and education for those on state benefits, showing a path to get off of them, a phasing out of those benefits so workers are not worried about suddenly losing those benefits, and a few weeks to adjust. Thank you so much.
Parents are college educated, yet we struggle with housing. As a little girl, I never knew if we were going to have a home to live in, if I was going to have food to eat. I did not have health insurance or dental insurance. I still deal with those ramifications to this day. That's part of the reason I became a nurse. Because I thought, what can I do to use my experiences to help others? This bill is going to hurt families and children like myself. It targets people who do not have advantages that a lot of us have. A lot of people do not have a high educational level that can understand even how these forms or documents work or how the process works. I feel like this bill is targeting a very vulnerable population, children. Think about your kids, for those of you who have children. What if you were not able to provide for them the way you wanted to because of life? Because sometimes life is difficult and things happen we can't control. You're taking away something that can help them. I want you to think about a child that you care about. This impacts Iowans and their health. I ask you to vote no.
They're working hard to somehow make it from one day to the next. Senate File 494 is an attack on poor Iowans. It would harm Iowa's families, children, seniors, and people with disabilities. It would harm Iowa's food banks, food pantries, and other anti-hunger organizations. It would harm Iowa's rural economy, hospitals, and grocery stores. This bill is a solution in search of a problem.
I am medically retired. I hear from a lot of people that I don't necessarily look sick, and that's okay because my bones and my organs are on the inside, so my doctors are the ones that know about my disability. It's important for me to be here today because I used to be a SNAP recipient until January 1st of this year when I received a cost of living adjustment with my Social Security disability check. And that made me ineligible for SNAP. The problem is that the cost of living adjustment does not make me not food insecure anymore. I still am having a hard time accessing the proper food for my specific needs. I have been relying on food that I get from the food pantry. There were several days where I just chose not to eat so that I could spread out the food that I did have access to. And I've been battling a very, very tough acute illness the past 4 months, and my body is actually rebelling against the few foods that I do have access to. I'm just continuing to get sicker unless I have a way to access foods that are low histamine, and those can be expensive. So I'm here today to speak on behalf of me, but also on behalf of my neighbors. Living in low-income housing, there are so many people who experienced a very small amount of a cost of living adjustment, and they lost their SNAP benefits, and they are going hungry, they're skipping meals. People are selling off personal items just to get food for the week, and it's just degrading. And it's upsetting to see that, especially my friends in the building who are retired military veterans being treated like they don't matter and like they don't belong, and like it's okay to be skipping meals. So I'm really grateful to be here to ask the representatives to vote down on Senate File 494.